Hello guys, welcome back to ultrasound teaching videos with Dr. Arshad Nadeem Awan. It's differential diagnosis series and I'm going to discuss about the liver differential diagnosis. Liver, there are multiple focal masses appears on the liver which appear as hypoequic and sometimes hyperequic. So differential diagnosis for the hypoequic focal nodules are different, and differential diagnosis for the focal hyperequic nodules are different. So I'm going to discuss first about the focal hyperequic nodules of the liver. Focal hyperequic nodule could be because of metastasis, echogenic metastasis. It could be because of hemangioma. Hemangioma is always appear as hyperequic. It could be because of hepatoma. Certain hepatomas are appears echogenic. Adenomas. Adenomas are usually hypoequic, but it may appear hyperequic as well. Focal nodular hyperplasia. Focal nodular hyperplasia most of the time appears hypoequic, but you can also see hyperequic focal nodular hyperplasia as well. Abscesses, when there is chronic abscesses, it may appear echogenic, or when there is chronic hematoma, it will also appear echogenic. So let's start watching this list and this video, and hopefully this will give you insight to understand differential diagnosis for the focal hyperequic liver mass.
Differentials of the hyperequic masses within the liver parenchyma include metastatic deposits. Metastasis especially from the gastrointestinal tract, ovary, pancreas and urogenital tract. These metastases happens to be hyperequic. Some of the metastatic deposits are usually hypoequic, but if there is hyperequic metastasis, you can consider gastrointestinal tract, ovarian, pancreatic and urogenital mets. In the second differential, there is capillary hemangioma. Hemangioma happens to be hyperequic and it has its own typical appearance within the liver parenchyma, so it is easy to recognize. Adenoma is another differential, particularly when there is hemorrhage within the adenoma. Adenoma is usually seen in the ladies who are on contraceptive pills, and adenoma is very common. Usually it appears hypoequic, but when there is hemorrhage, because adenoma happens to be are prone to hemorrhage, so therefore it appears echogenic within the liver parenchyma. Focal nodular hyperplasia happens to be hypoequic nodules, but in few cases these may appear as hyperequic because of its central echogenic scar within the tumor. Focal fatty liver infiltration, it should not be confused with the mass. It appears in the normal liver. There will be no fatty infiltrations diffusely, but it is likely that some of the area it will start having increased deposits of the fatty contents, and it will look like a tumor and it will look like an echogenic mass within the liver, but actually this will be focal fatty liver infiltration. In debris and other lesions, like for example, if there is abscesses or hematoma, normally abscesses or hematoma appears hypoequic, but because of chronicity and because of dense calcific foci and other debris, it may likely appear as echogenic. Hepatoma is a malignant mass within the liver, usually seen in hepatocellular carcinoma. You can call it hepatocellular carcinoma or you can call it as hepatoma, but usually it appears as hypoequic and sometime it may appear as hyperequic. So it depends upon the age of the hepatoma, it depends upon the size of the hepatoma. It may appear hyperequic and it may appear hypoequic, but in the differential of the hyperequic masses, hepatoma will also include.
Differential of the focal hypoequic mass within the liver parenchyma. Usually the differential is a bit prolonged than the hyperequic masses. Hypoequic mass usually seen in metastatic. Again, we have mentioned this in hyperequic differential as well. Hypoequic metastasis may be because of ovaries, because of pancreas, stomach and colon. these mets would be hypoequic. In lymphoma, particularly, the lymphoma will appear as a target lesion. It will appear hypoequic and it will be very easy to recognize on the ultrasound imaging. So always keep lymphoma in your differential. Hepatoma, as I mentioned earlier, that hepatoma may be hyperequic, it may be hypoequic. So in both cases, you may put this disease within your differential. As far as cysts are concerned, benign cyst, hydatid cyst, multiple daughter cyst, these are all considered to be a hypoequic on the ultrasonography, especially on the CT scan as well. So these all appear as a hypoequic, and these are, as it has its own equastic shadowing, so it's very easy to recognize them. But if in case of any confusion, you may put it in your differentials as well. Abscesses are usually appear as hypoequic. It has its hyperequic wall, but centrally it will be hypoequic because of the fibrosis. The wall will appear hyperequic, but centrally overall the mass will look like, the lesion will look like hypoequic. There will be internal debris sometime because of gas producing organism. There will be bright echoes within it, but you should not confuse with any other lesion. It would be abscess, and abscess usually appear as hypoequic on ultrasound imaging. In hematoma, especially in acute case, as it's all fluid and fluid appear hypoequic on the ultrasound, so a hematoma is another differential if you come across any focal hypoequic mass within the liver parenchyma. So far cavernous hemangioma is concerned, normally as I mentioned earlier, hemangioma happens to be echogenic, but when it gets enlarged, you can call it giant hemangioma or you can call it cavernous hemangioma. Because of enlargement, the area will become hypoequic and this mass will look hypoequic. So these were all the differentials of the hypoequic masses within the liver parenchyma.